Zimbabwe faces a crisis of infectious diseases.
Cholera is the tip of the iceberg, and it's emblematic of a collapsed public health system in Zimbabwe.
The collapse is man-made and preventable. Zimbabwe's government, led by President Robert Mugabe, has neglected the country's failing healthcare system to a ruinous state. Now, the death toll soars as epidemics of cholera, TB, and HIV/AIDS ravage the country. Worse, TB and HIV drug treatments aren't being properly distributed to patients.
They're being switched because of what's available in the pharmacy. And often this is happening rather than every 3 months, people picking up their meds, it's happening on a monthly basis.
Physicians for Human Rights fears that this will lead to drug-resistant strains of TB and HIV. Meanwhile, Zimbabwe's infant mortality rate has risen to 68 deaths per 1,000 live births. Life expectancy has plunged to an average of 36 years.
It has now fallen to among the lowest in the world.
In this climate, affordable health care is vital. But Zimbabwe's economy has utterly collapsed. Inflation of the Zimbabwean dollar, the nation's official currency, is the highest in the world.
You find economic failure caused by an uncaring government, which has abrogated its obligation to progressively realize the universal right to health.
Faced with a rapidly depreciating domestic currency, residents are forced to use foreign currency. Most businesses now prefer, if not require, payment in US dollars. The Zimbabwean dollar has become so worthless, it's literally strewn on the ground. But most workers are still being paid in Zimbabwean dollars. Mugabe's government has failed to effectively counter the dollarization of the economy. As a result, employees can't even buy a $1 loaf of bread with a month's pay.
How can you be proud of a country where we looked at a doctor's paycheck for the month, had the stub in our hand for 32 cents for a month's compensation?
So imagine the cost of health care. Since November, all of Zimbabwe's public hospitals have closed. Mission hospitals are scarce, overcrowded, and lack basic resources like running water. That leaves only private hospitals, but expensive dollarized fees exclude most people from affording them.
When you put all of this together, it is abundantly clear that there is a crisis of healthcare access, that the system is broken.
At a private hospital, an initial consultation costs $200 US. Patients staying overnight must pay $500. Intensive care costs just as much, provided the patient makes it to the hospital. Most people survive on less than $1 US per day. That makes private health care, the only quality care left in Zimbabwe, completely unaffordable. And among those left most vulnerable are pregnant women.
If you have a critical care problem, including a need for interventive obstetric care, operative cesarean section, you cannot get it through the public sector.
Zimbabwe now has one of the highest maternal mortality rates in the world at 1,100 per 100,000.
5% of Zimbabwean women need a cesarean section each year. That equates to 18,000 women each year.
But few women can afford Zimbabwe's obstetric care.
The two women we interviewed had been told at Mbuyanahanda, the main maternity hospital, to go for private obstetric care, but each of them separately reported to us that this would cost a total of $3,700 US.
Zimbabwe was once the breadbasket of Southern Africa. Its health system was a model for developing countries, but not anymore. Now residents live in a nightmare of exorbitant healthcare prices that leave them defenseless before raging epidemic diseases.
I have never, in my number of years of working in public health in developing countries, seen as extreme an example of a closure of a healthcare system.
It remains to be seen how the international community will respond to Zimbabwe's healthcare crisis. One thing is certain: this catastrophe is completely man-made. The solution must be as well.